The next question comes from Michael from CNN. Michael, could you unmute yourself and ask your question?
Good morning from British Columbia. Thank you for taking my question. A lot of Canadians were really jolted last week when they learned that the majority of Canadians won't be vaccinated against COVID-19 until as late as December 2021, so months after people in other G7 countries. And a big reason for this is, of course, we don't have our own domestic vaccine production. My question is the following. Given all of the previous warnings from WHO and other experts about a coming global pandemic, do any developed countries have an excuse to not have better prepared themselves for provision of PPE, vaccines, and even domestic vaccine production? Thank you.
Thank you, Michael. I think the pandemic has exposed gaps and weaknesses in all countries in terms of preparedness, both in terms of planning, in terms of expectations around the demands on PPE, the demands on the health system, the demands on simple things like contact tracing and the ability to process data in the system, to connect lab results with patients quickly, to have fast turnaround of diagnostics, to develop diagnostics and distribute them to trained workers, to manage clinical pathways so that hospitals don't become overwhelmed, to be able to rapidly convert health facilities to deal with more patients requiring isolation, to surge and to move health workers around in the system effectively, to provide them with PPE, to have adequate measures in place for what is, in a sense, a mass casualty event across the whole country at the same time. And when we look at things like planning for natural disasters, you know, we tend to plan for the 10-year disaster and maybe the 100-year disaster. Very few people prepare for the 1,000-year disaster. In this case, we've known that a pandemic is coming. We had one in 2009. We've had warning shots with diseases like H5N1. We've had warning shots with Ebola. So it's not like nature wasn't telling us to be careful, to watch out, to get ready. It's not like the scientists around the world weren't telling us to watch out, get ready. WHO has been speaking about this. I don't know how many World Health reports have had this as a theme. Dr. Tedros himself has spoken out almost before he was elected on this issue of health security. In our global program of work, one pillar of our whole organization's effort has been addressing issues around preparedness and response. The creation of a preparedness division last year directly addressed the issues around our concerns on this. So, but converting that sense of threat into concerted action at every level, that's been the difficulty, because the crisis that hasn't happened in people's minds is the one that it's very hard to get the investment in to avoid or to mitigate the impact of such a crisis. So I think we would argue, without fear of being contradicted, that we have underestimated the social, economic and health threat represented by emerging diseases, by new dangerous pathogens, and we have a lot of work to do, not just in the science field, not just in the health field, but in the area of investment in what we consider to be resilient, as Meg said, resilient. What is a resilient health service? A health service that can absorb a surge, that can absorb an extra demand that develops very quickly and rapidly. Our health systems, I think, in the north and the south, for different reasons. In the south, health systems are under strain because there's chronic underinvestment and they struggle to maintain basic essential health services. In the north, because of the cost model for health systems, we have designed our health systems to be delivered at 95, 98, 100% efficiency. It's almost like a low-cost airline model for health service delivery. Well, we're paying a price for that now, not having that extra surge capacity built into the system, seeing health as a cost center in our economy, seeing health as a drain on development, as dragging back the economy. And we need to readdress what that means. Health should be at the centre of investment for any government, both looking at the health and welfare of its population, but more, just as importantly, having a first line of defence when it comes to emerging disease threats. So I think there's there's plenty to go around here, and I think it would be unfair to identify the government of Canada or any single government. In fact, Canada has been on the leading edge of emergency preparedness and response. It was the first country in the world, to my knowledge, to set up a centre for emergency preparedness and response. That centre led the way in the creation of the Global Response Network, one of the first countries to do large-scale stockpiling of PPE and other materials for all forms of natural disasters, one of the first countries to deliver an all-hazards approach, managing all of its acute hazards to human health within a Centre for Emergency Preparedness within Health Canada. Has a very strong and decentralised public health architecture. I think there are British Columbia of Bonnie Henry and others there who've shown tremendous leadership. So Canada has much to be proud of, both in terms of national preparedness and stimulating global preparedness. Our first epidemic intelligence tool at a global level, called GFIN, the Global Public Health Intelligence Network, was developed by Canada with ourselves and represented, 20 years ago, state-of-the-art use of technology for epidemic detection. So I think, yes, all of us need to look to the future in terms of what more we can invest in this, and we are paying a price, all of us, for a lack of investment in preparedness and in readiness and in health system resilience. The question is, will we? And unfortunately, in my experience, and I have to say this quite honestly to you, I have seen the amnesia that it seems to descend upon the world after a traumatic event, and that's understandable. We all want to forget pain and suffering. We all want to move on. But if we do this again, like we did after SARS, like we did after H5N1, like we did after H1N1 pandemic, if we continue to ignore the realities of what emerging and dangerous pathogens can do to our civilization, then we are likely to experience the same or worse again, and within our lifetimes.
Thanks, Dr.